All right, Dr. Stephen Patton, let me have you say and spell your name just to make sure that I'm pronouncing it correctly and that everything is a-okay.
Stephen Patton, Steven Patton.
Perfect. And what's your title?
I am a family medicine physician and medical director of community outreach with Norton Healthcare.
Perfect. Okay. So, um, as I said earlier, we're seeing a lot of increase in flu in the area. So, can you tell us a little bit about this strain of flu and why are people calling it a super flu?
Yes, they have that new subclade K. This is the H3N2 variant, which is influenza A as well. And one of the main things with this variant, it kind of hits you out of nowhere. It can pretty much body slam you, fevers, chills, um, and it pretty much take you down from the couch without any warning. One day you're feeling fine, next minute you aren't. It still has about the same rate as far as being able to spread to others. One person can affect about every two people within 6 feet. Um, as far as the spread, and it's still a droplet as well, so people have to make sure they wash those counters and things in that nature. And then also those antiviral medications, as long as you're taking them within the first 48 hours, are still pretty much effective against that strain as well.
What kind of symptoms are people reporting? Is it just kind of typical flu symptoms? Anything different about this strain?
It's more so the timing and onset than the severity of it. I haven't really seen too many severe cases yet based off the data, but we are definitely seeing rises in flu cases, especially in the Jefferson County. I know that's numbers have almost tripled since early November, which is pretty typical for December, and around February is when you start seeing those increase in flu cases in general.
Okay, so that may answer my next question. I was gonna say, are you seeing any spikes in ER visits with this strain at all? Or is it mostly kind of urgent health based?
More so, it appears that people are still using. I haven't seen too many severe cases yet, so it appears that we are using our primary care and urgent care. But I would probably need to see some more aggregated data to, necessarily pinpoint that. Overall, we are still seeing cases even across the nation. We're starting to have that increase, but I don't think we've reached our numbers nowhere near where we normally peak at for the season just yet. So
It's still got a ways to go. No, I checked out the CDC map and it said while it's increasing, it's still kind of low for the region. But can you dive in a little more about what the timing onset is so people can see, hey, I'm not feeling good all of a sudden out of the blue. What kind of timing are you seeing for these symptoms setting in and how long does it linger?
yes, especially even with this strain. So people have to realize, one, once you get the flu vaccine, it takes about 2 weeks for full protection, and then also once you get the symptoms, before you start having the symptoms, which can be 1 to 2 days after exposure of being exposed to the flu, about 1 to 2 days you can have the symptoms, but that day before you have symptoms, you can kind of contagious, and then about 5 to 6 days after you even start having symptoms, you can still. That's when you're most contagious in that area. Now, one of the biggest things with this strain is too a lingering cough, which can go on for weeks. So that's something we have to be cautious about.
Okay, so I want to ask about the vaccine. Is it the proper strain? I'm going to be completely honest. I don't know much about the strain of the vaccine. So, is it too late to get it? Should people still get it? I know you said we're kind of still approaching the zenith of this flu season. So, tell us about the vaccine a little bit.
Yeah, so one thing important to think about vaccines is I always say they're like a bulletproof vest. They won't necessarily protect you from getting hit, but they can decrease the severity. And even with this current strain, now this strain is a more of a new variant before the our current vaccine was established and made for the public for this season. So it's not necessarily hitting the mark as far as it's going to give you full protection, but it is still showing that a 30 40% decrease in severe hospitalizations for those who've been vaccinated for adults. So that's still a very good sign to get vaccinated. Now, on average, when we talk about vaccinations, normally we get about 40. mid 40% coverage in the US or even in Kentucky in general. Now, to get herd immunity, to really get the best protection, we want about 70% of the population to get those vaccinations. So I would still urge people to go ahead and get their vaccinations. Remember, it takes about 2 weeks before you can even get protected from that. And even though this vaccine isn't necessarily covering this particular strain, by having that vaccination, you are still decreasing your risk of serious hospitalization or death.
And are you seeing this strain turn into more significant things like pneumonia, bronchitis, any sort of, you said there's a cough that lingers. Have you seen that turn into anything else at this point, like develop maybe pneumonia or any sort of illnesses related to that cough?
Personally, I have not seen the increased risk of the severe illnesses at this point. But I think that those who are at higher risk, immunocompromised, the elderly, should definitely get vaccinated and then still practice those safety tips as far as washing your hands, cleaning down surfaces, and those who are possibly infected or maybe showing some early signs to wear those masks, and also realize that within 48 hours if you're showing no symptoms, to get that antiviral treatment, because after that, that window, it won't last as long. So
Is there anything else you could think of that would be beneficial for anybody to know about this flu virus or any other symptoms of respiratory illnesses that are prevalent in Kentucky right now?
yes, I encourage people to get their vaccinations. Make sure you wash your hands. If you're feeling sick, wear a mask and warn others about that. Also, just make sure you talk to family members and just check in on them during these holiday seasons because it can get lonely, especially if we're worried about catching a cold.
Yeah, yeah, I have a cousin with COVID right now, so he had to miss Christmas. So yeah, that's really it for me, I think. Thank you so much for making some time. I know it's a non-traditional, medicine's always on. Hospitals and doctors are always on, but it's always hard to grab people after Christmas. So I appreciate you making time.
No, I appreciate you. Thank you for
Uh,
sharing the
oh,
story and informing
yeah.
people.